She's a director of the Nursing Advisory Board. Sue was also the co-founder of the Billy Project and a strong supporter of the Cholangiocarcinoma Foundation. So Sue has been working tirelessly over the last year to set up some nursing guidelines for the management of cholangiocarcinoma. As you know, particularly for extrahepatic cholangiocarcinoma, there are a lot of issues related to stents, external catheters, management of jaundice, and clearly there's a major deficiency there, management of cholangitis, and it starts with really good nursing. And Sue has spent a lot of energy and time, and she's going to give us an update on the nursing working group.
So on our Nursing Advisory Board, you'll see the following members, and Dr. Iyer is our medical advisor, and we have Georgine, who's one of our research students. And as you can see from some of your institutions, which we greatly appreciate, you have representatives from your institutions that are helping on our Nursing Advisory Board. And without them, I couldn't do this work. They're a great, outstanding group of nursing professionals. And we have a couple of PAs as well that have contributed to this work. And certainly at the end, we are on the recruitment lookout. So any of the members here from your institutions that you have advanced practice nurses that are interested in being part of our board, I am all ears in your suggestions, because there is a lot of work to be done, and it would be very helpful to have their help as well. The mission of their Nursing Advisory Board is really to advance the scientific knowledge, really the symptom experience of these patients and the quality of life of the patients with cholangiocarcinoma, and really to standardize the standardization of patient-centered care so that we can improve the quality of care for these patients, and really to facilitate our collaboration with the multiple institutions that are represented here tonight, as well as the Medical Advisory Board. The goals really are we want to develop some essential content for practice based on evidence and consensus and content validation. And we're really doing kind of, if you will, a Delphi light model, in the sense that we have a group of experts from around the country, nursing experts that have done an extensive literature search. And then as we evaluate the literature for its strength and evidence, then we go forward with writing and drafting the guidelines, and then we'll have consensus on those guidelines, and then present it to our Medical Advisory Board for approval. We want to be able to enable the nurses' competency and confidence in caring for patients with cholangiocarcinoma, develop white papers, publish the guidelines in peer-reviewed journals, and make them available on the nursing portal for Cholangiocarcinoma Foundation, and also really want to develop a framework for evaluation, future research for the effectiveness of these clinical guidelines, so that as we go forward, projects can be developed in the evaluation of how effective these guidelines were implemented. Our working model is, of course, the expertise of the Nursing Advisory Board, and the working model is assessment, the nursing diagnosis, outcome identification, implementation, and evaluation. And for us nurses, that's a very long-lived model called the nursing process, in which this was our framework in order to do our literature review, to be able to complete the standard or the guideline within that formal model that has been identified as an evidence-based model for a very long time. So really what we want as our results is, of course, the literature that supports this, plus institutional practice. Where we find that we don't have the literature to support our recommendations, we are comparing institutional practice, because we have nothing else. And so that's why the collaboration is so important. So the consensus then, plus our Medical Advisory Board's approval, then we'll develop the guidelines. So as I mentioned with the nursing model, the assessment, diagnosis, outcome identification, this gives you what they had to work with as a model, and really to complete in their assessment data, describe assumptions of biases that might interfere with accurate assessments. It's really the critical elements. And that's just for assessment. With diagnosis, of course, we have nursing diagnosis, and that's based on our assessments. And that's a formal, I would say, called NANDA, and it's the National Association of Nursing Diagnosis, and that we have a group of diagnoses that which we choose from based on our assessment. The outcome identification, of course, are goal statements for the patient developed by answering the question, what do we want to accomplish? And how is that related to the patient's goals that they want to accomplish? Always keeping consistent with what the patient wants as well. Implementation then, the critical thinking implement then, did they describe the most critical steps in the intervention and the interventions that best meet the patient's needs and maintain principles of patient safety. And then evaluation is what's our evaluation criteria to determine if our interventions were successful. Our initial submission of guidelines that we are going to present to the Medical Advisory Board are the following. We've been working this year with that model that I've just described to you on the care of the patient with external biliary drains and internal bile duct stents. In fact, I got this feedback last year from several of you that this was something that you felt had deficits in nursing knowledge. We agree. We certainly find a variation in practice at multiple institutions, and trying to standardize standardized practice and decrease the variation in practice is our goal to improve the patient quality of care. The care of the patient preparing to participate in the clinical trial on radiation therapy, care of the patient undergoing chemotherapy management, management of fatigue in cholangiocarcinoma patients, and care of the patient preparing for liver transplantation. So you see no small topics for guidelines, probably a very lofty goal, and there's a lot to each of those guidelines, but felt with the expertise of the group and the prioritization of the guidelines, and which also is why I'm presenting to the Medical Advisory Board. Are we going in the right direction? Are you also in concert with us as physicians that this is where we need to go with the establishment and development of guidelines? We are also in the development phase, certainly not ready to present our care of the patient with intractable nausea and vomiting, the external biliary drains and internal bile duct stents in home care, because we also want to cross over in the continuum of care as well, because we're going to have the care of the patient in the acute inpatient as well as home care. So there are some differences in those care standards. And then also care of the cholangiocarcinoma patient on palliative care. This is an example. This is the one care of the patient with fatigue. As you'll see here, as part of the assessment, most common side effects experienced. We have two courts, if you will, that we're dealing with. One is the disease process of the patient, and the other is the treatment. And so trying to determine in our assessment the symptoms that they are experiencing as a result of their disease and also as a result of their treatment. So this, you'll see in assessment findings. We'll see here at the bottom, their assessment must include patient-reported physical and psychological symptoms, current and past treatments, the medications. These are all data elements which as nurses that we gather in our data. Some good questions here that this is Karen Driscoll's standard or clinical practice guidelines. But the questions here, these are the kinds of questions that we would ask the patients so that we do a comprehensive assessment. Do you have a hard time completing your regular daily activities? And do you have a feeling of generalized tiredness that's not alleviated by rest? And rating the level of fatigue on the 0 to 10 scales according to Boardman 2013. So in any ratings, any evidence-based scales and any evidence-based assessment tools that are included in the literature, that's what we're incorporating as part of our assessment data elements. So that would be the assessment portion. Certainly not going to read you all of the assessment that we'd go through on that. But you see there, it's quite extensive, and we have literature citations for each one. The diagnosis part, based on that assessment, this is some of the diagnosis that we would expect as a nursing diagnosis. Activity intolerance related to the chemotherapy or the medication side effects, as evidenced by the patient or the family reports difficulty with their ADLs, or they report fatigue with starting or stopping activity, or they report discomfort or dyspnea with exertion, or the fatigue related to the acute infection, or indwelling catheter or stent related to bone marrow suppression as evidenced by, as you'll see there, and it goes on. So these are the kinds of standards that, or guidelines, elements that we feel are important to have a comprehensive guideline to guide the nursing staff. Outcome identification, so what would we expect as a result of our assessment and diagnosis? Our outcome would be, obviously, that we want the patient to be able to participate in choosing their ADLs that they can tolerate, such as they're brushing their teeth with minimal assistance. They're going to report a decreased exercise intolerance. They're going to report a pain level tolerable. Their SpO2 will remain above 90% when performing activities. So you see very objective data by which we can evaluate whether or not we're successful in our assessment findings and diagnosis for nursing. Then the implementation, so what are we going to do about this is implementation. So these are really kind of the guidelines. Probably the final version will have assessment data and guidelines, but like I said, we needed to have a model by which the critical elements were addressed, and then we'll go and as we present white papers, it will most likely be in a little bit of a different format. But in implementation, we want to be able to involve the patient in choosing the ADLs they'd like to accomplish, setting up their toothbrush, comb, soap, lotions, whatever, conserve their energy, plan for activities during the time of day when the patient feels the least amount of fatigue, and so forth. Implementation continued. You'll see there fatigue due to infection and the implementation interventions that we would do there. Fatigue due to disease progression. And again, assessing the pain level as it results. An evaluation, the fatigue due to disease progression, the patient as we evaluate them, do they reorient to the person easily? Do the patient's family take turns in staying with the patient throughout the day and night? Are they able to sleep for 4 hours throughout the night without interruption? Do we maintain their pain level at a 2 out of 10? And administering skin emollients and so forth. So that is just an example of the guideline that we are about to present to the Medical Advisory Board. And it's our initial work. Certainly before we get too far into the final development and the final draft, it's so important to have the physician's input on our work to make sure that we certainly are going on the right course. If these are the areas you feel the key aspects of care that we're addressing, and if we need to address different areas that you feel are more priority, we'll certainly take that to our board and work on the expertise to develop that. So, like I said, I'm on the recruitment search, so any of your institutions that have advanced practice nurses that are interested in really being part of this project in publishing and furthering our nursing knowledge, our nursing scientific knowledge, and in addition, setting up for future studies, future doctoral studies to evaluate the effectiveness of the implementation of these guidelines. So special thanks to Gassan and Renuka, the Nursing Advisory Board. Stacy, thank you so much for this opportunity. Marion, they've been a great help to launching this. So any questions?
Can I just say one thing while I'm walking over to Katie? I don't know if you had addressed this, Sue, or not, but so many of these patients are not seen in major cancer centers. And so sorry. And this not only will be on the professional area and the website, but also in the patient area when it's complete, when it's been signed off, so that patients can print and click and print this information, and they can give it to nursing staff who may have never seen cholangiocarcinoma before. When we're dealing with patient-driven medicine, most of our patients are not seen at major cancer centers, and most of them are being seen by clinicians who are not familiar with standards of care. So this is really important work. If you have input, please give it. And please, Sue's trying to get qualified people. We have a wonderful staff, but we need more if we're going to cover all of these areas. So if you have someone in mind who was willing to give a little bit of time and effort, we'll work to promote this work as well. But please have them get in contact with us, and we'll have them get in contact with Sue.
I may have missed this on your list, but I was going to suggest or comment that perhaps pruritus or itching would be another simple guideline that would be very helpful, since many of us don't have training in that, and it comes up quite a bit.
Thank you. Absolutely. Yes, we had talked about that, and yes, that is, we will, that's definitely one on the list, although I hadn't listed it.
So you have anyone from interventional radiology or endoscopy?
No, we need somebody from interventional radiology.
Because I think that would be key
To
in
the
terms of, the mid-level staff, even advisory board. I'm going to suggest several people. I would volunteer David Maddow over there. But really, I think their guidance would be important here as well.
Thank you.
It's remarkable work. Thank you very much.
Thank you very much. Thank you, everyone.